for surgery and surgical nursing, which we are looking at elective preoperative care, which means it will apply to all the elective surgeries or elective surgeries, the general management of preoperative care. So I want you, once you happen to cover this, you should also apply it in all elective surgeries. So first of all, we are saying preoperative care by definition is the care given to the patient before he or she goes to theater for surgical operation. So this preoperative, it begins from the time the patient is scheduled to theater, is scheduled for surgery. So what does it mean? The moment a doctor happens to tell this patient or to assign this patient on this day will have this surgery, that's where preoperative care starts from. So from that, a patient can be admitted to a surgical ward or surgical unit several days or few days before the surgery, before the surgical operations. The reason is very simple. One, you want the patient to acclimate or to get used to the surgical or to the ward environment. Two, you want to allay anxiety. Three, you also want the patient to be treated if there is any underlying condition, any underlying medical condition. You want it to be treated. We also want the patient to be used with everything that's happening, to know what's happening in the world. For investigation purposes, you can also admit the patient several days or few days before surgery. Before you go any further, you need to have your aims. So aims, before you get to the aims, let's define elective or surgery. What is elective surgery? Elective surgery is done to correct non-life-threatening condition. So this is the most ideal because it can be undertaken when the patient's general condition and local condition are controlled and favorable. So under elective surgery, this is a kind of surgery which can be done when the patient wants. So that it's involved life-threatening condition, maybe it can be just for cosmetic purposes. That's what elective surgery is. Maybe there is something which you want the surgeon to remove, or there are some people that develop it can be maybe cleft palate. Cleft palate is not an emergency. It's not life-threatening condition. It is not life-threatening surgery. So it can be done at any time. You just want it to be removed. Maybe some people that elective surgery can be done for cosmetic purposes. So during your management, during you answering the question, what you have to come up with your aims. First aim that you have to come up with your aims as you are writing for GNC or any exam. When it comes to preoperative, you have to have goals or your objectives. First one, you have to ensure that the patient is physically well to withstand the surgical operation and the effect of anesthesia. Also, you want to promote the physiological being of the patient. You want also to decrease the anxiety by preparing the patient psychologically and spiritually for surgery. You also want to prevent infection and other complications of surgery. You want to also improve patients' self-esteem and comfort. So that's all about the aims. You can come up with the objectives. You can come up with 4. It's enough. Then you go now to the main part. After you happen to come up with this, you go to admission. As we have talked already, when it comes to environment, the patient will be admitted to the surgical ward several days or few days before surgery, and the reason of which we have talked about already in the preamble. Then you go to, after environment, you know what you have to talk about environment. You come to the psychological care. Psychological care, this is the care given to the patient. Or the main purpose of psychological care, you want to decrease anxiety. Once the patient, you want to leave fears, because people, they are scared of unknown. You want to leave, you want to allay anxiety. You have to make sure that the patient understands the condition. So you can explain on psychological care. One, you explain the condition to the patient. You explain what's going to happen in the theater. These are some of the things that you can explain on psychological care, because the patient is scared of unknown. You make sure that the patient understands the condition, and you make sure the patient understands what's going to happen there. And you also explain why they have to do that surgery. You explain everything about it. From there, after explaining about psychological care, after telling the patient everything, there are main ways of which you can allay anxiety. Even you calling the theater nurses to come and talk to the patient, it's also part of allaying anxiety. If there is a patient nearby who had undergone that kind of surgery, you call the very person to come and talk to this patient that, no, I had undergone the same surgery. I was so scared, but I'm fine. In that way, the patient can become. Once someone is stressed, you know what normally happens when someone is stressed. Then from there, you come to preoperative teaching. When it comes to preoperative teaching, all what we are saying, the patient have got a right to know what's going to happen before, during, and after surgery. So under preoperative teaching, you just need to you explain on how you are going to teach the patient on breathing exercise, coughing exercise. Why are you doing that? You are preventing the patient from gapping, from the wound being gapped. You are preventing gapping. From there, you teach everything, what they have to prevent some complication, how they can be carrying their own on the preoperative teaching. Then, since you have explained already the condition, now you come to the consent obtaining for surgery. If the patient is above 18 years, you have to make sure that they sign in the consent form. A consent form is just the legal document which allows which tells the surgeon that the patient has allowed them to do the operation on him or her. But if the patient is underage, you have to make sure that they sign the assent form. Assent form is the form which is signed for the people that are underage. Assent form. Then from there, observation. When it comes to observation, we are paying much attention to TPR, temperature. When it comes to temperature, once the temperature is very high, it may indicate that there is a presence of infection. Meaning, before the patient happen to go to theater, you need to treat the infection. TPR, pulse. Once you happen to find that this patient has got high pulse and raised BP, it may indicate that there is a cardiac problem. You need to investigate that before the patient goes to theater. If the patient have got high respiration, it means that there's a presence, or it may suggest that there's a chest infection, or this patient is stressed. Meaning, you have to allay anxiety before the patient goes there, because if the patient happen to go there, it may alter the operation. You also the weight, when it comes to weight, you also weigh the patient, because most of the drugs in theater, anesthetic drugs, they are given package body weight. So you make sure that you weigh the patient. You explain on that. Then you all observe the general well-being of the patient. From there, you come to investigation. When it comes to investigation, you do general investigations. This is general preoperative care. So the first one, you do complete blood count or hemoglobin level to assess the blood status and to detect anemia, which will need to be corrected before surgery. So you do complete blood count or FBC. You want to rule out anemia, so that if this patient is anemic, you need to rule out. You need to treat it before the patient goes to theater, and you need to know. You do blood type and cross match. This one to help you. If the patient happen to bleed that side, you may do blood transfusion. You also do clotting studies. You want to do out there's some bleeding tendencies like hemophilia. If the patient have got bleeding tendencies, which means when once the patient happen to go there, this patient may need blood transfusion, because this patient by any injury or anything that has to do on him might bleed to death. If this is a woman, you may also need to do Gravinex test Gravinex test. You want to know out the pregnancy, the presence of human chronic gonadotrophin, which is produced, which is released in excess when on the 14th day. You also do electrocardiogram to assess the cardiac activities. You do chest X-ray to investigate the infection of the chest, to check the position of the heart. You come to nutrition. You assess the patient's nutrition status. You want to detect any nutritional deficiency. You need to treat if the patient is malnourished. You need to treat it before the patient goes to theater, because when you have to encourage the patient to be eating food which are rich in protein to promote wound healing after surgery. Now we come to preoperative preparation. Preoperative preparation. This happened on the day of surgery. On the day of surgery. Now you have solved the patient has signed the consent. Now this one is done on the day of surgery. Immediate preoperative nursing entails care given the patient a few hours before the patient goes to the operating theater. What do you have to do? Gastric preparation. You first you do physical preparation. Under physical preparation, we've got gastric preparation, bowel preparation, and bladder preparation. The patient's stomach should be empty when he or she goes to theater to prevent the possibility of vomiting and aspiration of vomitus. All food and fluids are withdrawn or withheld for at least 6 to 8 hours. Why do we have to starve the patient 6 to 8 hours? Because it takes 6 to 8 hours for the food from the mouth to the rectum, from the food from the mouth to from the food from the stomach to the rectum. It takes 6 to 8 hours. So you have to make sure that the stomach is empty. You also essential oral medication may be given at this time with small amount of water. So that's all about when it comes to gastric preparation. And if the patient has taken food or fluid by mistake, the anesthetics or the surgeon need to be aware about it. If they are aspirating, or they may postpone the surgery. You explain on that on the gastric preparation. When it comes to bowel preparation, the patient should be encouraged to open bowels before going for surgery. If not, you can even give enema to clean the colon. The enema cleans the colon for fecal material. Bowel preparation. Then from there, you come to bladder preparation. You catheterize the patient. You are preventing surgical errors. You may injure, or not really surgical errors, or surgical accident. You may injure the bladder, as the surgeon may injure the bladder as they are trying to operate the patient. So you need to catheterize the patient. From there, you come to local site preparation. This is the preparation of the incision site and surrounding areas. I'm sure you know about this. What you have to do, you need to clean the site. You need to shave the patient. Then from there you come personal care and hygiene. The patient has to have a bath or shower in the evening before or morning of surgery using antibacterial solution. Then after the patient happen to be bath, or you happen to take a bath or his own, you gown the patient. You explain on the gowning that before the patient goes to theater, the patient should be given a clean gown, as they will reduce chance of infection and will allow easy access to the operation site. Then you remove of dentures. You remove the danger because may become displaced during operation. If someone has a ring, you have to remove it. because when the patient happens to go to theater, there is diathem machine. Diathem machine is kind of machine which can cause electrical shock to this patient and may injure the patient. So, if the patient has nail polish, you need to remove the patient because the patient might be cynosed and may deceive someone. From there, you do patient identification. The patient identification, this is just the band which will be put. It can be on the forehead. It will have the name of the patient, the sex, age, date, diagnosis, and possible procedure. This is there to prevent surgical errors. We don't want to see a situation whereby the surgeon happened to send the porter to get a different patient, and when this patient wake up in the morning, find that he doesn't have, he or she doesn't have a limb. You have taken a wrong patient to theater, and this patient find that they happen to cut the limb to then a different patient, which is unfortunate. So we are preventing these surgical errors. You need to give there is also part for pre-medication. Under pre-medication, you can give these 3 drugs. 1, you can give diazepam to allay anxiety. 2, you can give MMT. MMT is given to neutralize hydrochloric acid. To neutralize this hydrochloric acid, you are preventing, since this patient there's no food, this patient will happen to starve the patient. The reason why you have to starve the patient, we have talked about it already. So the vendors need to be using this hydrochloric acid despite you not having food, and it will be just go on the epithelial of the GIT. So you are preventing this patient from walling out of or peeling off of the top layer of the GIT. You give this MMT. You can also give atropine. You want to dry the circulation. You're preventing aspiration pneumonia. Now you take the patient to the operating theater. When you get there, you find the nurse. You give the handover to the nurse. You explain on what to do from there and there. Then from there you come back. You make a post-operative bed. After making a post-operative bed, you know what's supposed to be there. You explain on everything that's supposed to be there on post-operative bed. What's there next? You communicate to the family members when the patient is likely to be back from theater, what time, how long will the procedure take. You explain everything. From there, you wait for the patient. This is all about general preoperative care when it comes to surgery. Preoperative care.